Hey, I'd like to welcome you to another episode of the Mission Matters Startup Garage Podcast, your source for all things startups. My name is Adam Torres. You can follow me on Instagram at AskAdamTorres to keep up with my book releases, book tour schedule, signings, all that other good stuff. Always love to connect with you there. And as always, if you'd like to apply to become a co-author of one of my upcoming books, just head on over to the website, missionmatters.com, and click on Become an Author to apply. All right, so today I have Alan Gale on the line, and he's CEO over at Amy Health. Alan, welcome to the show.
Great to be here, Adam.
So I'm excited to get into today's topic. So the future of AI-driven personalized healthcare. So you're the guy I want to talk to about that. But before we get into that, let's get a little bit further into what you're doing over at Amy Health. Tell us a little bit more about the company, please.
So we're a personalized healthcare company, and we utilize a 360-degree approach to helping improve people's health that examines things like your diet, your lifestyle factors, and how they affect different parts of your body that we ultimately even validate through biomarker testing. So we're a one-stop shop for personalized health and wellness.
So this brings us to today's topic, so the future of AI-driven personalized health. But I want to start this off with you maybe defining a little bit more the term personalized health, because I don't want to assume all of our listeners understand the nuance in what you're doing.
Sure, not a problem. So everybody's a little bit different. We have different genetics, we have different lifestyle factors, different health conditions. So the way that we each respond to different dietary changes can be unique. And so we employ a method that starts with the basic science for what we believe and what science suggests is the right approach to address a particular health condition. But then we validate it through actual testing, through a combination of online assessments to help evaluate whether your symptoms are improving, as well as at-home blood tests that can measure levels of different nutrients. And then we reassess any type of dietary intervention in order to help drive your results that may be unique to each individual.
And so what kind of... Like, how did you come up with this? So, I mean, to me, it makes perfect sense. Like, and especially as we go further and further with technology to be able to measure these things. I mean, how'd you kind of what led you to start this company?
Well, that's actually a long story, which we probably don't have time for. But in essence, I've sort of had these dual interests since I was in college over 30 years ago. And the dual interests on one side were about personal health and optimization, ultimately leading into being a biohacker. And then my other interest was more professional as an engineer. And I worked for a long period of time in communication systems, working with satellites and Wi-Fi and cellular systems. And I was fortunate enough to start and ultimately sell a company in the Wi-Fi space. And at that point, I decided I wanted to start another company that combined biohacking with engineering. So I didn't really know exactly what that meant until about 6 months following that, when I started drawing out how nutrition and physiology works as a wiring diagram, like I would do with an electrical layout. And one day, I had a complete epiphany that the whole set of tools that we use in engineering to understand complex systems could be applied to the human body. And we have input signals to the body and we have output signals, just like we do any other kind of communication system. And applying that to the body, we can think of input signals coming from nutrients that we get from foods and supplements primarily. And we can think of output signals as biomarkers, blood tests, vital signs, symptoms, for example. And so what we've done in our company is really put those together along with the science around nutrition and medicine that sits in between those input and output signals that we can measure.
Man, I love this. And I had a feeling you were that biohacker guy, and I mean that with as a compliment, by the way, because I wish I was, but I'm just a wannabe, all right? So I mean that as a compliment to you. That being said, What's your plans for Amy Health going forward? So, like, kind of what's the next step? Give us an idea of like what stage you're in, what the plans are, what you're trying to do next.
So we launched last year in 2019, and we are presently now in April of 2020 refocused our efforts around addressing immunity challenges that people have in protecting themselves from the coronavirus. And so we've used our essential platform that combines dietary analysis that we have with a mobile app that lets you take photographs of your food to help understand the nutritional content. We've created online assessments that can determine what kind of immunity needs that you have, and then science-based protocols, which we apply in the case of immunity with medical-grade products like supplements and home-based biomarker tests that we make available. And so really our focus right now is all around helping people protect themselves. And, we like to say that personal immunity is community immunity. And it's another way to flatten the curve, so to speak, because if I get infected with the virus and I'm able to defeat it because my immune system is strong enough to do so, that means the virus doesn't go and infect somebody else. And so it helps protect others that I come in contact with. And so that's really our main focus right now. There's been a great outpouring among the medical community, not just with respect to immunity, but to help address other types of health conditions that people experience. And so this combination of using online assessments and dietary analysis with a convenient mobile app and validation with biomarkers, is a system that we can use in many different areas. So we really want to help facilitate that interaction between the practitioners, the science, and the users themselves.
Man, that's amazing. I love it. And I love the versatility, and I love the way it was able to, I shouldn't even say, the word wouldn't be pivot, but I just love the functionality of it all, the ecosystem that you've built to be able to address other things as they come up. Because right now we're dealing with, again, in 2020, when we're recording this, we're dealing with Corona. In the future, it's going to be something else. And the good thing about Amy Health and what you're doing is that you're building that bandwidth to be able to help in other things also going forward. So I just love it. I love the ecosystem. So Alan, that being said, if somebody's listening to this and they want more information on Amy Health, I mean, what's the best way for them to reach out or to learn more about the company?
Really to come to our website first and foremost at amyhealth.ai. And from there, we've got a lot of great information about how our program works. We'll suggest that you start with an initial assessment, and we have various different health topics, including immunity and brain health, which we had been working on prior to immunity. And really from that point on, we'll be able to provide you with a lot of great information at no cost. We really encourage people to learn more about how their body works and how their diet affects their body. So we have our assessments that are available at no cost. We have our mobile app for food tracking available at no cost. The only things that we charge for are things like supplement products or biomarkers, which are totally optional. There's a lot of great things that people can do, just on their own through, utilizing our platform.
Fantastic. Well, definitely want to welcome you. Thank you for coming back or coming on the show, Alan. Been great learning about what you're doing over at Amy Health and how you're helping people with personalized health. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. If you did, don't forget to subscribe to the podcast, leave me a review, and if you're watching this on our YouTube channel, Mission Matters Startup Garage, definitely give us a subscribe there, but also leave us some comments on the video. I mean, love to hear what kind of projects and startups you're working on. And Alan, thanks for coming on the show.